There we go. All right. So just a quick disclaimer, this is meant to be general advice only. If you have any specific concerns or questions, speak with me or your medical provider directly. And this does not replace individualized medical advice. So please don't say, oh, I saw some lady on the internet that told me to do this, but it doesn't seem right, but I'm going to do it anyway. And then I'm going to get upset and anything like that. So just make sure we're being smart about applying the information that I'm providing here to your situation. So who am I? Some of you might know me, some of you might not. My name is Sarah Wynn Faruza. I'm a physical therapist, strength and conditioning coach, a whole bunch of other certifications. I'm a former gymnast, and I work treating primarily gymnasts in my physical therapy and strength training clinic, and that's in Fairfield, New Jersey, but I do also work with a variety of other athletes. So I use a variety of techniques, taping is one of those. And I like to teach athletes how to take care of themselves. So sometimes that is going to require taping, and that's fine. And I'm always happy to help athletes with that, but I like them to be able to know what their body needs and address it themselves, and same with coaches. So overall, what does taping do? So it can aid in a comprehensive medical treatment plan in easing and reducing pain, and it can make an athlete feel more secure. It's also important to talk what taping not does. So it does not replace a need for active treatment or medical attention. If you have something that's been bothering you, an ankle that's painful all the time, don't just throw tape on it and say, oh, it's fine now, that makes it better. Obviously, there's still a problem there. It does not turn on or turn off muscles. So that might be something that you've heard, but that's not been found to be true. It does not really prevent injury. So certain types of taping may reduce risk, but it does always come at a cause. If not to that joint, to another joint nearby. And it doesn't give us an excuse to compete or train injured. So if we're injured, but we feel okay when we're taped up, it doesn't mean, again, that we can just ignore that and push through. That's not a smart idea. So types of tape that I'm going to talk about today are athletic tape, which is like white tape or gymnastics tape, McConnell tape, which is brown tape, KT tape, which is going to include like kinesio tape and rock tape. And then finally, I'm going to touch a little bit on braces and ACE wraps. So athletic tape, this one might be one that you guys are pretty familiar with. So what does it do? It does attempt to provide stability to an otherwise unstable joint. But where does it get that from? So when we look at our body has a finite amount of mobility. So this can get a little bit complex, but just to keep it simple, our body has a finite amount of mobility and stability. So if we take stability, if we provide stability to a joint too much, we're taking that stability from somewhere else. So for example, if we tape up an ankle nice and tight and it feels great, we can't move it a lot, it feels super secure. Well, when we go out and we run and we jump or tumble or anything like that, we're going to have to get that mobility from somewhere else. And it could be a knee, a hip, a back, something like that. So that's something we want to be cautious of. Also with this type of tape, it's very dependent on the quality of the tape job. So you can, just because you have your ankle tape does not mean you're stable. We want to make sure it's a quality job and also specific to the type of athlete or type of injury that we're working with. It does improve perceived stability and confidence. So there is a study with taping versus a sham or fake taping, and it showed that the athletes that were taped felt more confident and felt like their ankle was more stable, even if that wasn't entirely true. And then the last thing is it improves proprioception. So we'll get into that a little bit more later. What does it not do? It doesn't prevent injury. Already went over that. It does not give an excuse to train or compete on an injured ankle. And it does not magically create stability. Like I said, when we add that stability, we're taking it away from somewhere else. So that's important to note. So the pros are taping has been found to prevent ankle sprains, but at what cost? So some studies have shown that athletes who compete with their ankle taped do have a higher risk of knee injury. There are some other studies that show that that's not true, but if it has been found in some studies, it's certainly something that we want to be concerned with and think about. So is there a better way to prevent sprains? So ideally, we want to keep our ankles as strong as possible. And that stability that we crave from the taping, we want to get that with our own muscles and our own ankles. So over the long term, really trying to actively improve our ankle stability is the best way to go. But that doesn't mean that taping cannot be effective in the short term, sometimes as we're returning from injury. So there's been said to be mechanical benefits of taping and neuromuscular benefits of taping. So the mechanical benefits refer to the actual stability that the tape is providing. So that's like, I can't move my ankle, I can't roll my ankle because the tape is in the way. But that usually decreases after 45 minutes to an hour. So any of you, or if you have athletes that have had their ankle taped or wrist taped, something like that, and feels great, feels nice and stable at first, but by the middle or end of practice, they have a lot more motion. It loosens up. Doesn't mean you're taping wrong. That just happens. It's kind of in the nature of the tape. The neuromuscular benefits are like, why else does it feel better? Why do they still feel like they're stable even at the end of practice after that tape is loosened? So that refers to improved proprioception and increased attention to the area and improved confidence that comes from wearing the tape. So everything's connected. Our brain is in charge of everything. So, people get a little bit funny if I say, oh, all pain comes from your brain. I'm not saying that you don't have pain and that you're imagining this pain, but if you didn't have a brain, you wouldn't feel anything. You wouldn't feel pain. You wouldn't feel good. Nothing at all. So just by having that tape on there, it kind of tells your brain, hey, I need to pay attention to this area of my body a little bit more and make sure everything is going okay in that area. So that's been one of the hypotheses as to why ankle tape helps so much, even when it loosens, is because our brain kind of improves that stability just because we have the tape on. Whether it's an ankle, wrist, those are kind of the most popular areas to be taped, but could be somewhere else as well. So what is proprioception? I just want to go over this term because we're going to be talking about it quite a bit in here. So it's perception or awareness of the position and movement of the body. So basically it's when you do a back tuck, how do you know when to open up? How do you know when to prepare for the ground? Some of you might be looking, opening your eyes, but that's probably not true, because whether you did a back tuck facing one direction, facing another direction, went into a new gym, went on a friend's trampoline and did it, you would always know when to open up. So it's your body knowing that. So it comes from what you're seeing, what you're hearing, and what you're feeling. But for the purpose of this, we're going to talk mostly on feel, because again, when you're doing a back tuck, you're probably not going to hear a lot of cues for when to open up. And if you're doing gymnastics, you might not see a lot. In other sports, you might see some things more that help you with proprioception. But a lot of it, at least 70%, comes from what we're feeling with our feet. So that's how we know, or with our body, just how we know when to land. So improving that proprioception is important in having safe landings. Just letting somebody in here, and then I'll get back to it. One moment. All right. Perfect. My internet is not great here, so if I could just get somebody to type in the chat real quick, just let me know that they're hearing me with what I'm saying. All right. So is there a way to get the neuromuscular benefits from taping without the mechanical restriction? Yes. Kinesiology tape really seems to do that pretty well. When we compare that to white tape, it's much less restrictive. So thanks, Kaylee. Thanks, Loran. So for most instances, I really like using some sort of kinesiology or flexible tape over white tape. That doesn't mean there's no place for white or athletic tape, but it's just my preference. I am a movement professional. So the more that we can move, the more naturally that we can move, I think it protects the rest of our body a lot better. So we can still add stability to certain areas without necessarily taking that from somewhere else. And I think this works out a lot better with this type of tape. So why kinesiology tape over white tape? I kind of went over this, but less mechanical restriction, so less impacts on other joints. It provides the same proprioceptive input, if not better, due to the elastic nature. So most kinesiology tape, when you put it on, it's stretched a little bit. So as it comes down, it kind of pulls the skin up a little bit, and that improves your reception. So just like imagine if you put your hand flat on your arm right here, your brain's going to realize it's there. But if you grab and you gently pinch that a little bit, that realization is going to be a little bit more. So that's kind of what kinesiology tape is doing. It also does not lose its effectiveness as quickly. So we just talked about how with white tape, it loosens after 45 minutes to an hour. And kinesiology tape can go at least 48 hours without really much decrease in its performance. So it's also been shown to improve endurance. It can be used on a variety of joints, which is not necessarily true with the white tape. And it's water resistant. I put a little asterisk there because certain brands do a better job of this with others. But for anybody who swimmer or just likes to be in the pool, likes to be in the water, or even sweats a lot, kinesiology tape is probably your better option. So what does it do? It decreases short-term pain, and these are all things that have been proven with studies. It increases short-term range of motion. It increases perceived strength. So it's not actually improving how strong you are, but improving how strong you feel. It regulates muscle activity, and it improves lymphatic flow. So lymph, some of you might be familiar with that term. It's kind of the fluid that's all around our body. And when that fluid gets stagnant is a lot of times related to when we have pain. So this could be with an injury or with more of a long-term like overuse or chronic pain. That lymph is going to be stagnant. So the kinesiology tape actually lifts things up and helps that flow a little bit better. And what does it not do? It does not have an effect on long-term pain reduction. It does not have an effect on long-term range of motion improvement. It does not have, like I said, no actual strength improvement. This was from a 2013 study. It also does not turn on or turn off muscles as once hypothesized. So when I first became familiar with kinesiology tape, it said that you have to put on the tape from one direction to the other and it's going to turn on the muscle, and you're going to put it on from that direction back to the first part and it's going to turn off the muscle. And I had a lot of trouble buying that, and as the studies came out, it showed that that just did not happen. But what it does do is it regulates muscle activity. So when you put it over a specific muscle, no matter which way you start, which way you end at, it's going to tell the brain, okay, I need to pay attention to this area and do a better job because I'm not doing a good job here. So that might mean in some areas you don't have enough muscle activity, so it's going to upregulate or increase that muscle activity. And in some areas you have too much, you're very tense or tight, so it's going to help downregulate that. But it's not as though you put it on one direction and it turns it on, or one direction as it turns it off. It just helps to regulate back to what is an appropriate amount of muscle activity. So the dangers of kinesio tape is possible minor skin irritation. It is contradicted in people with heart failure and renal failure. But other than that, it's not very dangerous. So some people do have that skin irritation more than others, and there's some different things you can do to mitigate that, some different types of things that are better than others. But overall, for most of the population, it's very safe. So do I use it? Absolutely. So although there is some differences in how effective it is, and like I said, it's not producing long-term pain reduction, it's not producing long-term range of motion improvements. And typically with my interventions, I want to focus my time and attention on things that are going to make a long-term improvement in what's going on. But with the kinesio tape, I feel like usually takes me about 5 minutes, if not less, to apply it. 50% of people, this is just anecdotally, this is not on a study, this is in my experience, about 50% of people feel a significant benefit, and about 50% of people feel no change or a very small benefit, or they're not really sure. I've only had one person with a significant skin irritation limiting their ability to continue to use it. and no other effects outside of that. So I do think it is an effective intervention for people who have pain, and it's one of the first things I recommend. Because of course, if somebody hurts themselves, they come see me and we want to get them better. But in the meantime, it's okay to make them feel better so that they can continue what they're doing. Or if you have an athlete, if you're a coach and you have an athlete and they have a small injury or something that they're working on, it might be okay for them to get taped or taped to help them continue to train within their ability, within their doctor's recommendations as they heal. Because we can't just get rid of pain and injuries overnight. It is nice to have something that can make us feel better immediately while we continue to work on that. So we talked about the dangers already. So some other uses for kinesio tape or rock tape for bruising and swelling. So you guys can probably see in this picture here, somebody who had big bruises on the back of their legs. And they put the kinesio tape in a specific pattern over it. And because it does lift the skin and improve for that lymphatic flow, it also improves in getting stagnant blood out of the body. So you can see how effective that was in reducing bruising in certain areas. And then you can just go ahead and put it on, apply it again over the areas that were not touched the last time, and hopefully get rid of that bruise in a day or two. It's also really effective for scarring, so something that's under-addressed is people who have surgeries, C-sections, even a major cut. The body kind of builds up tissue to protect that area, and it can affect our mobility overall. So if any of you or you know somebody who's had a C-section and then even later on they try to do a back bend or something like that, they're going to have some issues there likely due to the scarring. So the kinesio tape can help with that a lot. And it can also help with posture correction. So I only use this with certain people, not so much with athletes. I really, again, like to take an active approach. But some people are interested in using those like posture braces or something like that. And I do think the kinesio tape can be a little bit more individualized to that person and can help along with an active program in improving their posture. So real quick, I just want to go over different brands of the kinesiology type tape. So there's KT tape, and that's probably the most available. You can find that usually in CVS or Target. It comes in pre-cut strips, which is nice for athletes when you're using it on yourself. You don't have to worry about how long something's going to be. Rock tape is my preferred brand. It is the most adhesive in my opinion. It also comes in a thick strip that can be used in certain areas of the body. So I've got one right here. It's about 3 inches thick. And so for low back pain and things like that, it's nice to have just one thick strip like this. They do have a couple of different brands and or sub-brands under the rock tape. So the rock tape H2O is really great if you're somebody who wants to go in the water with the tape on, or if you just happen to sweat a lot. I used to play a little bit of adult soccer I was in Texas, and it was the summer and it was very hot. I started rock taping my knee and it just would not stay on. So I got their H2O brand, put it on, no problem at all. And then Kinesio Tex is another brand. So it's more cotton-like. It's more similar to rock tape. It is a little bit cheaper. With that, I don't think it stays on as well, but depending on your needs and what you're using it for, it might be all right. And it does come in a large roll. So the one problem with the pre-cut strips is depending on exactly where you're looking to address, where you're looking to tape, they may be too short for your needs. You may end up having to stack different strips together. So the ability to have just one nice long roll is helpful. So this one is, you might be familiar, you might not be familiar with it, leukotape or McConnell taping. So this is a picture right here. This is the most common use for it. And does it work? So many studies have been done and there's conflicting answers or conflicting results if it alters muscle activity, but all of the studies seem to show a decrease in pain. So I say this because I know some of you on here are gymnasts or gymnastics coaches, and this is super common, like a patellofemoral pain syndrome, something like that. So this is one way that is effective for it, but I will say with gymnasts, it does limit their ability to bend their knee a little bit. So most other athletes or different types of activities, we don't have to bend our knee to a full degree of flexion, and it's okay. But in gymnastics, if we're doing a back tuck or anything tucked, we do. and it can be a little bit tough for that. So yeah, Kaylee, so you've experienced that before. So it does. So it's kind of pros and cons to this. And this is the reason why it seems to work. So I hope I don't gross too many of you out, but some, especially young female athletes, they get what's called patellar maltracking, or their kneecap doesn't really sit in the groove that it's supposed to. So it can be either sat on the outside, like in this picture, or sat on the inside. The tape basically seems to compress it down into that pocket it's supposed to sit in. So it improves the positioning, which is why it does seem to improve the pain in people whose kneecap are sat too far out or too far in. But again, it does come at some cost of reduced mobility. So again, it depends what type of athlete you are or what you're going to be using it for. And like I said, those would be the cons. It may be helpful in someone who has a very hypermobile kneecap, or it moves way too much to control that. But in other people, it may cause too much restriction and again affect other areas of the kinetic chain, because if you can't bend your knee all the way, you're going to try to get that motion from somewhere else. So that can lead to some problems there. So there are some other applications for it on the foot and the elbow, and these don't seem to limit mobility as much. That's something that we can get into if anybody's interested, but if not, I'm just gonna move past that. So bracing, I'm just gonna touch on this, and this does not apply to post-surgical bracing or acute post-injury bracing. And what I mean by that is if you just hurt yourself, within a month and the doctor told you need to wear this brace right now while things heal, that's a different story. That's necessary most times and can't really get around that. What I'm talking about is long term. So you had a minor sprain of your ankle 6 months ago and you're still wearing a brace. Or, you hurt your elbow a year ago and you're still wearing a brace, and we're not really letting anything heal, just seem to be doing it. If it's just a sleeve for compression, I'm okay with that. Compression has been shown to reduce pain, so that's fine. What I don't really like it for is for stability. And the reason that I'm going to say that is that most braces are not custom fit. So most of them, their hinge or their holes for your knee or your elbow or whatever you're using it for might not line up exactly with your anatomy, because they might only be made in 3 or 4 sizes. But as humans, we're made an endless amount of sizes and different, our bodies are just put together differently. So I don't think that's always the best thing, because you certainly don't want a knee brace with a hinge where the hinge doesn't bend where your knee bends. It doesn't matter if it hinges where the average medium-sized American hinges. It matters if it works for you. So that can be a problem. They're also generally restrictive to movement. So like I said before, if we're restricting our mobility in one area, it is going to steal some mobility from another area. The other thing is it may decrease proprioception. So like I talked about before, proprioception is our ability to feel our body in space, especially for this example, our feet on the ground. And if we have a thick ankle brace that we're wearing, we might not feel as well. So we could have some trouble with that. And some of these braces can get caught on our other sports equipment or body parts. So a real quick story about that. When I did gymnastics, I had torn my ACL. I was wearing a brace afterwards. I did need to be at that time. But either way, I was flipping and I got my finger caught in my brace and I broke my finger. And I'm not the only one that's happened to. I've seen that happen to other people who are wearing braces. And if you need the brace, that's one thing. But if you don't, if there's another way to get around it, if you're able to tape or something like that instead, that's probably the better move, because your fingers are not going to really get caught on the tape so much. So that's why I'm a little bit weary about braces, unless they're absolutely necessary for a healing period. So overall, we talked about a couple of different types of tape there. So how do you choose what kind of tape? As an athlete or as a coach or medical professional, how do you suggest different types of tape? So a lot of it is going to be on the athlete preference. So we talked about how a lot of the benefits seem to come from the tape being there and the athlete in their brain feeling more confident and feeling more stable. So to that end, it doesn't matter exactly what type. If they feel like they're more stable with one kind of tape than another kind of tape, that's probably the better one for them to use, because that mechanical advantage is so slight. It's really all about the neuromuscular benefits. So I will say to that end that if you just had an injury and you're trying to compete, trying to work through it, I don't condone this. I don't think this is a good idea. If you need to tape something up so tight to compete, you probably should not be competing. But I do know that that happens more often than not, or you had an injury and you have a big hike or a big event plan that you really just want to push through. So the white tape will provide a little bit more of that mechanical advantage in those situations. So that might be what you're looking for in those scenarios. But what I will say is that active problems require active solutions, and tape is a passive solution. So what I mean by that is if your knee always bothers you when you're running or when you're jumping, that's an active problem. It happens because of the way that your muscles are working, the way that your joints are working in relation to each other. So to make that better, to truly solve that problem, we have to do some active things. We have to do some active exercise. We have to readjust the way we're running or jumping to stop causing that pain. And tape does not do that. Tape just essentially puts a Band-Aid on the problem, but it might be helpful in conjunction with active work. So like I said, if you are doing that active work, you're working on any muscle imbalances you have, you're working on improving your movement patterns, but in the meantime, you just want to reduce your pain a little bit, then it might be okay. So that's just something that we need to remember, that this tape, even if it takes away our pain, it's not solving the problem. So I will do some demonstration. First, I want to know what questions you guys have. And then also I'm happy to do any of these as a demonstration or anything that you guys request. So let me know what you want or what questions you have. And then I have my references here. If anyone wants, you can ask me for them again. I'm just going to stop screen sharing so I can see the chat a little bit better. So Kaylee would love to see the ankle white tape demo. Okay, perfect. So we'll start with that one, and then anybody else, just let me know anything that you want to see. I, unfortunately, due to coronavirus, I cannot have anybody here to demonstrate on, so I will have to demonstrate on myself. So it's not as easy as doing it to somebody else, but I will do my best. And I'm just going to tilt the screen down here so you guys can see. All right, hopefully you guys can see there okay. So the way that I do the white tape, so what I'm going to show you guys is kind of the middle version. So I've taped sometimes really restrictive if somebody needs a lot of stability, or sometimes a lot less restrictive if somebody just needs a little bit. So I'm going to kind of go in the middle here, and then we'll definitely go over a knee taping as well. So to start for this, I like to just anchor one strip at the top wherever I'm going to stop it. So usually I'm going to stop it just below the muscle belly of the calf, but that's going to depend. If somebody is having pain a little bit higher up in this area, we might go a little bit higher. But if the pain is generally around the malleoli, or the bones of the ankle that stick out, I'm going to go just below that muscle belly. We want that calf muscle to be able to contract as much as possible. One there. I apologize again. I was painting today, so I didn't quite get a chance to go home. So one there, and then one on the bottom. These are going to be kind of the bookends of what the rest of my tape is going to look like. Then the next part is pretty important. So what we want to avoid usually when we're taping is that ankle from rolling in or out. So what we want to do is create some stability on each side. So the way that I'm going to do this is come around the ankle. And what I like to do is with one strip, I'm going to go over or slightly in front of that ankle bone that sticks out. And then when I come around the other side, I'm going to go behind that bone on the other side. And we'll secure that down. So ideally, you don't want any wrinkles in that tape as best as you can. Then we're going to do another one, and this time we're going to go over and slightly behind that bone on the inside. And then we'll come up slightly in front of it on the outside. And that kind of gives us a good stable base. And now we can start the rest of their taping. So if they are having some Achilles issues, before I go over the rest of the tape, I'm gonna give one strip from just behind the heel on the Achilles and just bring it down evenly on each side of the foot. But that's really just if they're having some Achilles issues. If not, I'm gonna skip that step. And then what we're gonna do is the rest of our taping, we are gonna start from the foot and we're gonna go up. And whenever we're taping, wrapping, bracing, if it's white tape, if it's not kinesio tape, that's generally what we wanna do. The reason being, if there is any swelling, we always wanna push it up towards the body. We don't wanna squeeze and push it down towards the toes. So I'm gonna start at the bottom here. And we're just gonna wrap around. We want it to be secure, but we certainly don't want to be cutting off any circulation, any toes turning blue. When we get to the ankle here, there's a couple of different options. So we definitely want to do a figure 8 across the front of the ankle. I hope you guys can see this okay. And then down the other side. Now, if this athlete is going to be wearing a shoe when they're competing, or if they are not, depending on what sport they do, or if they're going to be barefoot, but we need a lot of stability, we're going to do something called a heel lock. So we're going to do the figure 8 regardless, and we can always just reinforce that figure 8 one more time. But if we want to give them a ton of stability, we're going to come around the bottom, and then we're going to come along the heel, but we haven't crossed over. We're just going to go around one side of the heel and come up. And we're gonna come down the outside of the heel. So in the same direction, I'm at the top here, and I'm just gonna angle down this way. And then I can reinforce that again with the figure 8. And then I'm just gonna wrap up top. So if I were actually gonna be working on this tape, I would wanna use some pre-wrap underneath. No necessary pattern for the pre-wrap, just make sure it's covering under the tape. Usually just one layer is best, or one layer slightly overlapped by another layer. We don't want it to be too thick, or this tape won't be able to be tight enough. So just like that, and then we can finish wrapping around just to kind of make it look pretty. And that is all. So the main points there, the main things that are kind of, I consider non-negotiables when we're taping an ankle, is that we have 2 strips that go from one side down and up the other side, so kind of like the stirrups there, and then that we have that figure 8 going over the ankle. The heel lock is just if you want it, if you want a little bit more stability, but again, it is going to restrict your mobility a little bit. So if I go to plantar flex or point my toe, that's about as far as I can get. And let's see if I can kind of show you both of my feet. You can see there's quite a difference there in how much I'm able to do that. And then flexing, same thing. So there's one closer to you, I'm able to dorsiflex quite a bit more. So my mobility is restricted, but I also feel pretty stable. All right. And then Alessandra would like to see the knee taping. So this one would be with the kinesio tape or rock tape. I'm going to use the rock tape right here. And I'm going to show you 2 different styles of taping. One is a little bit more restrictive and one is a little bit less restrictive depending on what you want. So when I first started taping, a lot of times I would take this strip, which is about 2 inches wide, and I would cut it in half at different points to go around joints and things like that. After I took a rock tape course, they actually put the full 2-inch strip on each side of the joint. And once I started doing that, it does seem to work out a lot better. So what I'm gonna do here, I'm gonna show you, I have a roll. So if you have a roll like this, you'll cut it. If not, for this first knee taping, those pre-cut strips are pretty much perfect. And what I'm gonna do is make 3 even strips. And I want them to be about 8 inches long, but I'm not gonna go nuts with getting a ruler, just about that. And it's also gonna depend on your body size. So if you're tiny, you might get away with 6 inches. If you're larger, you might want a little bit more, but we have about that much. And then we're going to cut, so we have 3 even strips. And just gonna adjust myself. So with the kinesio tape or rock tape, we want the joint or the skin where we're gonna be taping to be a little bit stretched. So if it's my knee, I don't want my knee to be fully extended or fully straight when I tape it, or else when I bend it, that tape might peel off. So I'm gonna keep it kind of in the middle. I'm not gonna bend it all the way, but it's bent at about 90 degrees. And what I'm gonna do, we'll go with this knee here, is we are gonna outline our kneecap with the tape. So we're gonna take one piece and do kind of the letter C on one side of our knee. And when you're applying this tape, it's best to have the skin dry. You may want to use some rubbing alcohol just to clean off if you have any lotion on or anything like that. And we're going to take another piece. And we're going to make a letter C going the opposite direction. So we've now surrounded the kneecap. Pretty much, we don't have to be directly on it. We do want that kneecap to be able to move a little bit. But the good thing about the tape is that the kinesio tape doesn't have that mechanical restriction. So our kneecap is still going to be able to move regardless, even if the tape is there. And then with our last strip, so we have one inside, one outside. With our last strip, we're just going to go around under our kneecap here. So a lot of people with knee pain get some pain right below that kneecap. So this is just going to go straight around our knee. And it should go about halfway to 3/4 around our leg, depending on our size. If you are going to be in the water or sweating a lot, you may want to do a full lap around the leg here to secure it a little bit better. But for the most part, that would be good there. And then I will also show you the other way of taping it. So this other way is if you have any pain in the back of the knee, and it's also slightly more restrictive, but again, with that a little bit more supportive. And this one is you're not going to really be able to do with the strips because we just need one long piece. So this is going to be about the same length as those 3 8-inch pieces together, or about 2 feet long. And one thing I forgot to mention, it does seem to work best when you're taping if we round the edges. So we just match them up and we can just kind of cut the corners into a round piece. That does help it to stay on a little bit if we're looking for longevity. And then what we're gonna do is find the middle of this tape and we are gonna rip it right in the middle and open it a little bit, so just like a Band-Aid. And then we are going to get that to go directly behind our knee, below where the hinge in our knee is. So the very, very top of our calf muscle. And then we're going to take one edge of that and come across the middle and up onto our thigh, and the opposite edge. And we're going to come along the outside and up onto our thigh. So again, this is a little bit more supportive, but also I think a little bit more restrictive. So that is that one. Donna, any suggestions for tennis elbow taping? Absolutely. So I will show you 2 different ways for this. Donna, if this is for you, tell me, when you have pain with your tennis elbow, is it very specifically in one spot, or is it kind of around the area? Forearm pain alone with directly on the bone. Okay. So 2 different ways. So like I said, the tape is going to help regulate muscle activity. So when we have tennis elbow, it usually means for some reason our extensor muscles, or the muscles on the top of our forearm, are overactive. And what it does is it kind of pulls on this little part of our bone called the lateral epicondyle. The official name for tennis elbow is lateral epicondylitis, meaning swelling of that area of the bone. And it's usually because those muscles are overactive and pulling on it. So the easiest thing to do is you want to find your extensor muscles on your forearm. So how you can do this is kind of hold your arm like this and lift your hand up. And then as you kind of walk your fingers along it, you'll feel the muscles that are active. So for me, it's going to be kind of directly across here. And all I'm going to do is put a piece of tape. So starting at the elbow, wherever that painful point is, and then along those muscles. Very, very simple taping, just like that. Hopefully, if you have to go to work or anything, you have a better color than purple rock tape like me. But just like that. And now I did go up on my hand. I would probably want to cut it right at the wrist, but as I'm doing this quickly. So no stretch on that. So with the kinesio tape, actually, that's another thing. So some people kind of argued over different amounts of stretch. But really what we want is that the tape kind of pulls the skin and pulls everything up a little bit. So when the tape is laid down on the paper in the factory, it's stretched out at about 50% stretch. So all we want to do is keep with that stretch. So we don't want to take it all the way off and just let it go back to no stretch. We want to try to keep that 50% stretch, but we don't need to add any more. If it helps you to lay it down, you can add a slight amount, but we don't want to really be yanking it to the end of how far it will go. So just a small amount of stretch there. I will show you, Donna, another really cool tennis elbow taping. This one's a little bit complex, but very effective. So what we're gonna do for this one is take a small piece of the kinesiology tape, about 3 inches, a little less than half of one of the pre-cut strips. And we're gonna make a little bit of a tab with this. So we're gonna take the middle portion of it and we are gonna fold it against each other. So we're gonna have a tab in the middle, one part with the sticky side attached to each other, and then 2 tabs. So if I was actually taping and these ends touch each other and I had to pull them apart, I'd have to start over, but just for right now, we'll go with this so you can kind of see that. And what I'm going to do is then find that most painful area on my forearm. So most people who have tennis elbow, it might be a little closer to the elbow here or a little bit more in the muscle belly here. Either way, we are going to put that tape right over that most painful area like this. So you can see the tape's on there, and now I have this tab up like this. And then what I'm going to do is take another piece of tape. This one a little bit longer, so if you're using a pre-cut strip, they're usually about 8 inches, so it's perfect because we have 3 inches here. We want about 5 inches here. And what we're going to do is attach one end of this right to that tab. So I just put it, right now it's just overlapping with the tab. And now here's where we're going to use some stretch. is I'm going to take the rest of this part, so tab is on the inside right there, and now I'm going to apply some stretch over that tab and just wrap around the forearm like that. So that's going to help a little bit more if your pain is very much in one spot, where this one will help a little bit more if it's along the forearm. Hopefully that helps for you, Donna. If you have any other questions about that, you can reach out to me. Otherwise, my email, if anybody has any questions later on or anything they think of, or I know I'll have some people that requested a replay of this, so if you have questions or want to see any other demonstrations, my email address is info@perfect10pt.com. If you are watching this, but you do want a replay and you did not sign up with your email address, I did post the information directly in some groups. Just type your email address in the chat. But other than that, any other questions for me? All right, guys, so we will cut it off there. Like I said, if you have anything, info@perfect10pt.com, best way to get in touch with me, or my website is perfect10pt.com. You can get there and that will give you the option to get in touch with me. Thanks for watching. Have a good day.